the meeting, and also because of the fact that we had to change the links, and we want to apologize for that. It was due to technical challenges, and so we quickly had to switch to this. Thank you very much for your patience and for joining this new link and staying up until this time to join the link. And so today we have as our guest, as we all know, the Aster Global Award winner, Madam Naomi Oye Oti. And then as our moderator, the Director for Nursing and Midwifery at the Ministry of Health, Dr. Barnabas Yabua. And so with that, I would hand over to our moderator who would take us through the program. And so Dr. Barnabas, over to you. Thank you all very much.
Yeah, hello, good afternoon, good evening, good morning, wherever you find yourself on the globe. Before I continue, can we all mute our audios? Can we all mute our audios? If you have not muted your audio, kindly do so right now. Have you all muted our audios? There's a feedback. Okay, so thank you very much for making time to join us this afternoon around the world. Today is a special day, and it's supposed to be what we call a pre-conference webinar. The title of the webinar is Leveraging and Influencing Global Health, the storyline of the 2025 winner of the Aster Guardian Global Award. I believe you have all heard about this news, good news for Ghana, and we are happy to engage and have a conversation with our colleague who has made us very proud on the global arena as far as nursing and midwifery is concerned. On behalf of the Ministry of Health and the Office of the Nursing and Midwifery, we welcome you to this important conversation. So today we have the extraordinary honor of hearing from the 2025 Global Aster Guardian Awardee, a pioneer advocate and a compassionate caregiver, transforming oncology nursing in Ghana and beyond. Let me say that feel free to introduce yourselves on the chat box. We want to know who is here. So just everybody chat your name, write your name on the chat box, your name and where you work, so that it will serve as the record for the webinar. So kindly tell us your name and which facility you are working in, or the region you are joining us from, or which country you are joining us from. We know we have our friends from other countries joining this webinar. So this webinar will have about 6 sessions, and I'll be taking you through moderation, as Evelyn has said. So I will first of all introduce our guest speaker for this webinar. So she's a leading clinical oncology nurse specialist and head of nursing at Ghana's National Radiotherapy Oncology and Nuclear Medicine Center. With over 2 decades of experience, she also serves as the registry manager at Cancer Registry and is an adjunct faculty member at the Ghana College of Nurses and Midwives. She's the 2025 recipient of the Aster Guardian Global Nursing Award with an award amount or a prize of $208,000. I believe none of you have ever seen this kind of money before. Myself, I've not seen one before. So this is a very great achievement, and we are very proud of her. Yeah, so Naomi has led the development of Ghana's postgraduate oncology nursing curriculum and trained over 60 oncology nurse specialists and 10 breast care nurses. Her influence extends continent-wide, mentoring oncology nurses across Africa and shaping cancer policy through roles with the International Society of Nurses in Cancer Care, and among others. Her outstanding contributions have earned her several prestigious honors, including the 2023 Dr. Dosia Kisia International Achievement Award, the 2022 Ghana Ministry of Health National Nursing and Midwifery Excellence Award, and the 2016 ISNCC Past President's Award for advancing oncology on the globe and in Ghana. She holds a postgraduate membership certificate from the Ghana College of Nurses and Midwives, an MPH from Kwame Nkrumah University of Science and Technology. I didn't know that you school there. I also did my master's there, so we are colleagues there. A bachelor's in nursing and psychology from the University of Ghana, and specialized oncology training from the Cross Cancer Institute, Canada. Her research focuses on breast cancer, survivorship, psycho-oncology, and symptom management. Naomi is a passionate advocate for the advancement of oncology nursing in Africa through education, mentorship, and international collaboration. Colleagues, welcome me. Join me to welcome Madam Naomi Oye Ohini Inti. Let's give her a round of applause. You can just wave. So Naomi, let's see your face.
We also have very few staff here. Also, we were ordered to put the phone on silent while on duty. That's why we didn't realize.
Esther Hagan, can you mute?
Anyway.
Esther Hagan, can you mute? Right. Can we see Naomi? Can you see her? Good. So now we will go straight to the interview. Why we are here to understand. The objective is to understand where Naomi is coming from. How did she get this award, among others. So I will pose some questions. She has some PowerPoint presentation to answer some of the questions. So as we ask the questions, you give us the answers. So I'll start first of all by saying congratulations, Naomi, for being named the 2025 Global Aster Guardian Awardee. The question is, what inspired you to specialize in oncology nursing, especially in a country like Ghana, where cancer care comes with challenges? Over to you, Naomi. Can you tell us why you chose to do oncology nursing? Hello, Naomi.
Hello. Hello, can you please hear me?
Yes, we can.
Good afternoon, everyone.
Good afternoon.
Really pleased to be part of this webinar. I also want to extend my appreciation to the organizers, Ministry of Health, the Director of Nursing and Midwifery, Ministry of Health, for giving me the opportunity to share my journey. It's not been an easy road. That said, My journey in nursing began with a deep desire to transform nursing and also improve on patient outcome in under-resourced setting. And as for me, what really struck me was when I was in my final year as a nursing student at the surgical department, in one of the wards, I came across a young patient who was a breast cancer patient. If we, in our performance status, had a very good performance status, but she was always in pain and had a whole chest full of tumor. So I began asking questions about what can be done for such a patient. And the answer from one of the surgeons was that they've done what they need to do, the options available. They had done surgery and the disease had come back and she had only one option of chemo and that was it. So they only have to give her pethidine, looking at the threshold of the pain. And that got me thinking if there was something that really needed to be done. So I think after school, that was on my mind that I could do, what can we do to help this patient? So after school, there was an opening at the oncology center, radiotherapy. So I applied and I had it. When coming in, as I came in, I saw that there was only one oncology nurse at that time who, and anytime there are issues, she was the only one. There were other nurses, she was the one they who always pull along to ask what they can do. So I really wanted to be this kind of a nurse who is always ready, poised, and had the questions. I mean, the solution for issues or challenges that come on. But that was Madam Rose Odai, now with Nursing and Midwifery College, Kolebu. So as time goes, I had the opportunity of going to the US at Mayo Clinic, and that was a turning point. I saw that all the patients that were being taken care of were being taken care of by specialist nurses and at different categories to the advanced level. It got me thinking, and then missing out. It means that every cancer patient needed to be taken care of by a specialist nurse. And there was some limitations. We didn't have it back home, but I went in to be trained in clinical trial coordination and breast care. So what happened, I took maximum interest in what I could learn and then bring back home if we could translate something within a setting. So there were a few changes. In addition, my head of nursing at that time, he was very accommodative, and together with the oncologist, we together were able to change certain things. But one defining moment was when I went to my first cancer conference, which was spearheaded by the first oncology nursing, the Oncology Nursing Society, the president at that time, Pamela Haylock. She helped me to go for my first conference in Sydney, Australia. That also was through, I had to fight for it. It was a fellowship. I had to write and it was a competition. So I had it and went in. That was when I also found this oncology nursing distant education course. I was so intrigued into it, asked the bearer of that course who came in to spearhead that course. And then we came into some form of, not really collaborating, some in tune that I really, really want to do this course. So I brought it home, got one few physicians at that time, one Professor Van der Paaij at this moment. And because she had trained in the US, also saw the significant impact which oncology nursing were making in the supporting the idea, lobbied her. We went to management. Initially, it was a bit skeptical because how can you do a distant education course, which this thing is skill-driven. And we pushed, together with other people, we pushed and it was accepted. So two of us were sponsored to do this program. And later on, lobbied management, went in to collaborate with Cross Cancer Institute to have our first, well, I say first formal oncology nursing training program. So seeing the gap within, in terms of skills, the gap of most of our patients not able, not being taken care of by specialist nurses. That also got me intrigued to go into this specialty, irrespective of our limited